Hello everybody, my name is Kayla. In this video I'm going to go ahead and do a massage for you on myself. I'm going to describe what it's like, what it is that I'm doing, and hopefully it will inspire you to create your own massage routine and technique. This is not a how-to step-by-step instructional video, so I'm just going to show you kind of what I do for massage. And again, I encourage you to go ahead and make it your own technique and make it work for you. So, first thing I do, you just palpate a little bit. I'm going to start on my right side. My right side isn't too bad, so it's easy for me to clear these points over here. And right now I'm grabbing and squeezing the trap muscle with my hand, my opposite hand, left hand, right trap. I'm just looking to activate those trigger points. I'm fortunate on my right side at this time. These points are very difficult for me to activate, especially manually. I'm really not getting much radiation up over here. But this SCM is starting to talk to me, so I'm going to start here with it. SCM, you grab manually with your hand. If you turn your head, that will pop out, and you can start right here at the bottom. Grab it with your claw. You can feel a little bit of radiating there. It's into the side of my face and my ear just a little bit. When you find a point of tension, you grab and squeeze, or you apply constant pressure. I basically just palpate, look for those points of tension. When I locate them, I apply the trigger point pressure, and then I move on. That's all I'm doing. And I just chase it around. It's like as one part is treated, there will be another part that I can feel needs attention. And sometimes it's tricky to find the pain because it moves around and it radiates and it'll activate other areas. But I just palpate and grab. And this was not easy for me. I struggled with the SCM massage. I've been doing it for some time, so it's much easier for me now. I feel this right up behind my ear, into my temple. But I really had to work to be able to do this technique properly and massage properly. So you have to take your time, Starting is as easy as palpating your muscles and getting familiar with them. Just find that trigger point, and it's still right up here behind my ear and a little bit into my face and right here in my nose. And then to get the very top of the SCM, I was using opposite hand, left to right, to do the top. You do the same one, and you can get all the way up under. And those are still tight for me. I can feel that in my throat. It's almost like my uvula. I used to have a bad pulling and cinching feeling in the back of my throat. Very deeply affected, very deeply felt symptoms. In the middle of my brain, in the middle of my neck, in the center of my throat, between my shoulder blades. And the joints of my arms and shoulders is very deep. But now everything is much more superficial. I have a little bit of like that ram's horn radiating going on right now. I'm just grabbing and holding. And I can feel I also have a little bit of radiating and tension here in the other side. I can tell next I'm going to start right here on the other SCM. But that's how you get the top of it. So same hand for the top, opposite hand for the bottom. Again, I chase my trigger points around. I start somewhere and my body will just tell me what to do next, how long to hold, and what to do next. So that's something I've developed over time. I've worked up to my massage tolerance. I was getting professional massage for a while before I found the Curalistic program, and then I began massaging myself every day. I still get professional massage. I enjoy my massage therapy. My therapist has been very helpful to me in my recovery. This SEM isn't too bad. I can feel it. I can feel it right here on the sides of my arms. They're brachial plexus entrapment points. So you'll feel that affects like the nerves here, you know, your brachial plexus nerve. You kind of get into the thoracic outlet syndrome from that muscular compression. I'm just grabbing and squeezing and holding. That's trigger point pressure. That's all it is. That's all Curalistic is. Trigger point pressure. And in addition to the pressure, I do also actually massage. There are 4 main treatment areas, the traps and SCMs. I do focus on those, but I also do a lot of work on my shoulders. And this one isn't too bad. I can feel it in my ear. The tops of my SCMs are some of my most sensitive spots for me. That's the one. My left side is my affected side. I still have some severe trap muscle dysfunction up at the top of my neck. I had a bad head tilt. My head was down, my shoulder was up, kinked my neck right here. My muscles are very depressed there, very flat. It's like they're stuck. But I'm working on that. I can feel this trap radiates right into where I still have muscular dysfunction. So I treat the main trigger point in that trap muscle so that I can correct the satellite trigger points, the ones that come off of it. And it should eventually fix that muscular dysfunction if I can clear these trigger points. And I just, right here, right on top, you got like your upper trap point and then the top of the end of the muscle here. I mean, I will massage. I massage whatever that hurts, but I do focus. You want to focus on your main points because this is this is the root cause. And I feel that I'm getting my ram's horn. That's what I call that, like the radiation up over the ear. Feels like you have a big horn on your head. Get that. I get tension sometimes right up the middle. I call that my skunk stripe. This one's not too bad today. I never feel knots or balls. I just feel like right now my ear, I feel a lot of ear pressure. It's like I get between my muscle fibers and there's just a sore spot. It's like once you hit it, for me it's like it lights up and everything radiates and you get those sensations. Now when you start at first you want to be very gentle. I said I've been massaging for some time, so I grab, hold, squeeze, you know, firmly for quite some time. This is something you work up to. I suggest people simply begin by palpating their muscles, identify your trigger points, get used to your hands and your positions, and gradually work up from there. I'm going to go ahead and use my back knobber for a minute. This is the massage tool specifically recommended by Curalistic. You got a big side, you got a baby side. I like to use the big side up here on my traps. You can get it right into these trigger points. And hold the bottom, put it in the point. And you can just push it right down. It's getting harder for me to activate my trigger points, which is good. You know, that's progress. I used to feel, oh, if I would activate my traps, I would feel it all the way up and like through. It was like each side was right up. I mean, I feel it's like a string or a strap or something cinching me. I mean, through the side of my head, through my shoulders. The pulling sensations have been incredible. And this would really radiate and make me symptomatic, you know, when I was that affected by the massage, but gradually, like I said, everything has become more superficial. So what you're doing, you're working things up and out. You still just have, I can feel it up into my neck and around this ear, and a little bit on this side now. I used to get like burning or tingling, like my whole scalp would feel like it would tingle sometimes, and just incredible sensations. I feel that right here, and this is where that muscular dysfunction is for me. And I just have it in that point, and I'm just pulling it down. Again, if you are new, go easy. Start with your hands first. And now I'm going to do my massage, because I just want to move over my muscles. I want to rub them a little bit. And I'm just in my shoulder. I do still struggle with my shoulders because I do a lot with them. My baby is going to be 2 on Monday. I could not even hold him at all for a while last year. Every time I picked him up, it was like I had just strings hanging off of me, off of my throat and my chest, and it's like I'd pick him up and it was like little weights were just pulling me down, just pulling from here, and I felt very heavy, and my neck and shoulders hurt incredibly. I'm just massaging my shoulders a little bit. This is for me personally. I said your main points are in the traps and the SCM muscles. You focus on those, and I can feel while pressing here some radiation into here. But you have to, decide what your body needs, where you are affected. And I'll spin around here in a little bit and show you guys some stuff from the back too. I massage, explore, find a point of tension, press and hold, and keep the pressure. That is my technique. And I just go where my body tells me to go. There's some very localized radiating there. It used to be when I would get work done on my shoulders, especially by my LMT, I can feel it all the way down into my arms. I mean, through the center of my arms, along the top of my hands. Like there was a string that just ran all the way up to my arms and shoulders, and I could feel it radiate that far. And now I'm to the point, like I'll be like, why is my collarbone hurting, or why does my forearm hurt? Like if I didn't know that it was trigger point activation and radiation, I'd have a much harder time putting 2 and 2 together. But I don't radiate as much. My symptoms don't activate as easily. And this is why you massage every day. Because when I was getting just professional massages, every 3 or 4 weeks or whatever, they were helping, but they were very difficult too. Like I couldn't get anything done to my neck, not even to the back of my head. I could hardly lay flat on my back. I couldn't put pressure on the back of my head. I was constantly moving and trying to be comfortable. And I would flare. I would flare during massage and after, and up to like a week after my massage. It just wouldn't feel right. I had a lot of problems with dizziness and balance issues, but the massages also helped. I was not having good luck seeing doctors, so I did keep going and doing them. That one's really bad. And it's the same spot on the other side, and these are trigger points in the shoulders from the trap muscles. But once I found Curalistic and began treating myself every day, I was not regressing as much and aggravating my trigger points in between massages. So my professional massages became more productive, and my recovery really became more linear when I began the daily self-treatment. Again, this is for me personally. I'm just taking you through my massage. I had severe neck and shoulder instability. It's when my shoulders destabilized that my neck was really strained, and I began suffering neurologically. And I am I'm really working to. I've been enjoying the time with my son, and it's nice being able to pick him up and hold him again, but I really need to be done with that because it is straining my shoulders and it is hampering my recovery. So that's where I am now. Strain the shoulders less, do the massage and recover more. And that almost goes even into my teeth right there, like I can feel it right in that tooth. So I have that radiation into my, but I can't feel like I used to be able to feel, like I would feel it the whole way up and through the roof of my mouth and into my tooth. Now it's just like, this tooth feels funny. Like, it's amazing the sensations that I've experienced during massage, and the things that I felt during massage is absolutely incredible. Now it's a little more obscure. It's like, why does this side of my face feel a little weird? It's because I've got my back knobber and my shoulder there. Alright, I think I'm going to go ahead and just turn around for a second. I'm going to switch over to my small side, and I'm going to work on that spot in my neck a little bit. Get the upper trap points, because I can feel I have like kind of tension back here. I'm starting to get that pulling. I used to have a severe tension and pulling there, and my head was literally just being pulled like that by my muscles, and so that way it was terrible. So that, when you have it, but it should always be a good hurt, never anything uncomfortable, and you should only invoke your symptoms as you're able to handle them. I had extreme neurological symptoms. I felt very bad for a long time, but I was able to return to a normal level of function, and now I am also feeling better. That's why we do it. All right, spinning around. And demonstrate first with the small side. Gently palpate. Find that upper trap point and apply trigger point pressure. This is just constant pressure held for a short amount of time. I also do circular and back and forth motions to massage. You can use the back knobber into your other neck muscles, the scalenes, levator muscles, paraspinals, even up into the occiput. Gentle circles, up and down, and even a longer dragging movement. I'm going to show you the larger side now, the bigger ball. You can do the same thing in the same area. Even do that dragging movement more effectively. Trigger point pressure into the upper trap. I'll show you that one more time. Start at the upper trap attachment, through that top trap point and into this one. Crank and hold the pressure. I really enjoy massaging like that. This is just intrascapular treatments, getting the trigger points and the rhomboids. There are also lower trap points. I don't have those framed in right now. I'm not going to demonstrate the lower trap points. I don't massage every point all the time. I massage what I can when I can. Today we're focusing a bit on my shoulders. Found a spot, so I keep that trigger point pressure. A little bit into my serratus muscles. Try and stimulate some muscular tone and function. Trigger point pressure in the upper trap point. And treat the right side of the neck just a bit. And a bit of that circular trigger point pressure. A little drag on this side as well. Get the scalenes, the levator muscles. And that's it. Alright, and that was a little bit of my massage in the back. I definitely think I use the big side of the back knobber more, but the small side is nice when you're trying to work your neck, but that big side's good too. And then you can do that slide into the trap point or down through the rhomboids. My left side is still, I feel a little bit here, and my left ear is still a little plugged, but I've been doing a lot of massage lately, and I'm having some dental problems right now that are making me flare a little bit, but I am managing well. I look forward to getting that left ear opened up a little bit again, and for me, that's where I'm currently affected, is right here on the left side. I just have a little bit of muscular dysfunction up underneath the occiput, and that left ear, I feel like I'm wearing an earmuff. This is what I feel like. I wear an earmuff and it's really uncomfortable back here. But I've definitely come a tremendous way from where I was before. But again, massage, it's going to be quite an experience, especially if you are highly affected and have that nerve involvement. Treating those trigger points is going to invoke your symptoms, which is really where, the delicacy comes into play. It's like you have to discover the techniques for massage that work for you. You need to learn your tolerance for massage, like how hard can you massage, how long can you massage for, and then you need to work through those, and it's called graded exposure. You eventually do more and more until you're running everything and treating daily at full capacity. I hope that this helps you guys develop your own massage technique, and that said for me, it's very strange. It's not something that people really understand unless you're going through it and experiencing it, or if you're providing therapy to people who are experiencing it. Those things that said, that radiating, the nerve sensations, the neurological symptoms, the flares. It's all very typical from treating your trigger points. And whether you're treating your trigger points or not, you're likely going to be experiencing these symptoms. So in my opinion, it's just more productive to be invoking them on your own and working them up and out, instead of being symptomatic with no productive end to it. I said I pretty much just felt like crap for a really long time, but I was able to regain my function, and then eventually did actually start feeling better. It was just something you have to do every day, have faith in, and keep going. It is important to address your stress responses and trapped emotions that may be in your body. I encourage you to pay attention during your massages. See what kind of emotions or memories or thoughts are brought into your mind during massage. It's all our traumas, our stresses, our emotions, our experiences. It's everything that we've sent out of our brain into our body and have tried to tuck away into the muscles. And when you're working through that, it will translate. You may have, emotional experiences or revelations during massage. That means that you're doing it properly. And if you are in this space, I encourage you to process and release these emotions as they come up, because if you don't work on your stress response and your anxiety response, and your brain is still operating exactly the same, then it will continue to tell your muscles to be tense. You can massage every day, all day, for a long time, and you will stall your own improvements if you do not address that tension signal from the brain. Again, I hope that this helped everybody, and that you can develop an effective massage technique to treat your own trigger points. And I will be sharing more information as I can. Thank you very much.